and each as an inspiration in the days ahead. So here's basically why we're doing this. We unfortunately have yet to see the full weight of this virus in our state. This order is not only justified, it is morally necessary. We are confident in our steps we have taken, but we cannot lose steam in the middle of this fight. Epidemiological modeling that is done at the University of Washington, it's one of the premier research institutes in the world today. We're so fortunate to have them in our state. And that modeling predicts we will have over 1,000 deaths in our state, and that there will be more if we do not continue our stalwart efforts. The science is clear. More people will die if we stop now. I'd like to show you a chart that informs us about this issue. This chart shows the cumulative cases per 100,000 population in 5 states. The most cases are in New York, the top line. The second highest line is New Jersey. Washington is the line in yellow. And the curve shows that the things we're doing appear to be working. They've given us additional time to build our hospital capacity to serve the surge of patients that may be coming. And this chart shows that our efforts can pay off. But I'd like to show you this second chart, one that demonstrates one reason why we need to keep going. This chart shows the percentage of tests that have come back positive over the last 2 months. And you will see to the right that these positive percentages are going up, which is a cause for concern. I'm telling you this to show you that actions based on smart, reasoned data and science can have a positive benefit and are in our state. We're not out of the woods yet, and we shall never flag or fail in our commitments to win this battle. We will not accept unnecessary deaths in our state. And I know that we need to think about all of the ramifications of this order. They are a heavy weight on all of us, including myself. We know that more Washingtonians will be in financially precarious positions through no fault of their own because of this virus. And we need to exercise all our efforts to find ways to support these Washingtonians. We've taken dozens of steps in that direction already. Under our my emergency powers, we've exercised a moratorium on evictions for non-payment of rent. We've organized mortgage forbearance. We have provided utility ratepayer assistance. We have increased unemployment access. And we've provided flexibility on tax payments and cash assistance to families. We're pleased that Congress has given us funds to help the hard-pressed small businesses whose whole business plans have been so disrupted. And we think of the owners of small restaurants tonight, and we're looking forward to them reopening. It's one of the reasons we want to beat this virus as soon as we can, so we can get these businesses reopened as soon as we can. Because the fastest way to economic recovery is for a recovery of our health, which is fundamental to all we hold dear. So first, to save lives, to rescue Washington's economy, we've got to preserve lives and defeat this virus. And that is the only goal of this Stay Home, Stay Healthy initiative. As Franklin Delano Roosevelt said in his very first fireside chat in 1933, he says this to our nation: more important than currency, more important than gold, and that is the confidence of our people. Confidence and courage are the essential success in carrying out our plan. It was true then, and it is true now. I have confidence in the courage of Washingtonians, and it is already being displayed across our state. We really are in the middle of a massive mobilization, fueled by every sector of our state, to save the communities we love and to show the world that we will be committed to rebuilding them when we are past this storm. Part of that effort is the sacrifice of business owners who had to shut down and the workers who've struggled to pay their bills. But this is temporary, and it is important for us to work forward to the ultimate conclusion of our efforts. Yesterday, I put a call to our manufacturers to begin producing the personal protective equipment that we need to help our healthcare workers, our public safety workers, and our essential workers across the state. You know, today hundreds of businesses are meeting this challenge already, and thousands more individuals are engaged their own time and their own resources as well. Some of your local shops and restaurants are still selling online or providing takeout service. And if they're closed, I hope people will consider buying a gift certificate for that business to use when this is all over. I'm thinking of all kinds of sacrifices people are making, like those of our nurses who are leaving their families and rushing into this dangerous fray. Nurses like Brandy Nakata, she's a nurse at St. Anthony's Hospital in Gig Harbor. She works with COVID-19 patients every day. Her peers describe her as a light in dark times, and boy, she sure is. I got to speak with her and her young son Monday over a video chat, and I just am so proud of what she's doing. I made her Washingtonian of the Day, and I think everybody would agree with that assessment. I'm also thinking of our members of the National Guard who are now in Washington State. They're supporting food banks so that people's basic needs can be met. By the way, the National Guard's role is not related to enforcement of their orders, just to helping people out. So there are no new restrictions in this bill. It does not reopen schools, although we certainly are having discussions about the next steps that our schools will take. And it is still important to reduce non-essential travel and non-essential contact with others. As I have said before, and I will say again tonight, all of us are leaders in this effort, and those who are watching out for their parents and grandparents and reminding them not to go out and defer visits to them so that we don't infect our loved ones of advanced age. This can make a life or death matter for our loved ones. It's springtime, Washington, I note that. It's still okay to get outside and get fresh air. It's very important for health. But our state parks are closed for a reason, so people don't congregate there and infect each other. It's tulip season in the Skagit Valley, but that festival is canceled for the same reason. I know that's painful to a lot of folks. We all love the tulips. But our office has heard large numbers of people are still trying to visit anyway, and that's just not safe. And the local organizers have asked people to enjoy the flowers around their homes this year and come back next year to the Skagit Valley. We hope you do that. And just because we're outdoors doesn't mean we can forget social distancing. This virus can still be outdoors, so we got to maintain that 6 feet on our walks around the block. So in summary, we are going to reopen our parks. We are going to reopen our restaurants. We are going to reopen our schools. And today is a big step towards doing all those things. Taking big steps is in the nature of Washingtonians, and that's what we're going to do. And I look forward to our victory in this effort. I'm joined tonight by Department of Health Director John Weisman, State Health Officer Dr. Kathy Lofi, and Vice Admiral Raquel Bono, and we will be happy to stand for your questions.
Okay, that's Governor Jay Inslee in Washington. We just are listening to this live news conference, and the big thing out of this, the governor has now extended the stay-at-home order for Washingtonians until May 4th, so at least another month for the stay-at-home order in Washington. It'll be interesting to see if neighboring states like Oregon follow suit with that.
Right.